And you are now streaming live.
Can somebody got it up there?
Here, I can just do it.
No.
Here we go.
You can do it on the screen too, just to let you know. You can?
Yes.
You can.
On this big screen?
Yes, you can.
Okay.
So this is Senate Appropriations, and we're continuing our work on the 2023 budget. And at this time, we're going to be taking testimony from the Green Mountain Care Board regarding their appropriation. Apologize for a little late start at a meeting outside the building. And so we'll get started. We have the chair, Kevin Mullen, and then a board member, Robin Lunge, a familiar face, and Jean Stetter, who's the Administrative Services Director, is also all familiar faces. So we have this document here, if that's what you want to work from. And so, Chair Mullen, I'm going to let you lead off, and then however you want the presentation, and to proceed from there, I'll let you take it however you want staff to participate.
Kevin, you're muted.
Muted.
It's a beautiful fall day where he is, anyway.
Yeah.
You know, I was jealous of one of the backgrounds that one of the legislators had, and my administrative assistant heard me and put that on as my background. I don't know how to change it, so it's going to stay that way. We use Teams. We don't use Zoom at the board. That's the official state of Vermont policy. So, but anyways, for the record, Kevin Mullen, Chair of the Green Mountain Care Board. I'm joined today by Jean Stetter and Robin Lunge, and it's good to see some familiar faces, even if it's not in person. And we'll get right into the presentation. And for the most part, I'm going to let Jean walk you through the budget, and Robin and I are here to answer any questions. So Jean, if you want to walk senators through the budget.
Sure. Hi, good afternoon. We've met before, but I'm Jean Stetter, Administrative Services Director for the board. We have one slide before we get into the budget, and we thought it was a good opportunity just to touch on what makes the Green Mountain Care Board unique, and it's the transparency. You know, all meetings happening in public, following open meeting law, which we've done consistently throughout the pandemic, engaging stakeholders. We're also independent, which is particularly important with federal partners that we have for innovation work. And we also have the benefit of a system-wide view where we have a unique role in the healthcare system, and helps us to understand how regulatory decisions impact one another. You know, and there's always areas for growth, but so system-wide view, transparent, and independent are what make us unique. Our FY23 budget is.
We could do that same for us, couldn't we? We're transparent, independent, and system-wide.
Absolutely.
When is the 2 years?
Yeah, we only have 2-year terms.
Elected.
Okay.
Yeah. Oh, that's an important difference.
Yeah.
All
Is
right.
that-
So
Yeah.
the government recommended budget.
Yeah, so our budget is kind of blessedly boring. We were grateful that the administration, even though we're independent, we do follow the governor's budget request, and we were grateful that the administration allows for
All right. Well, Bill back triggered a thought because we've had some discussion about the clarity of our statute and where
Sure.
that. So.
well, do you want to jump into that right now?
No, I don't want to get into that about the statutory. I was just looking at the bill back versus the general fund split. That was all. That just triggered a stream of consciousness.
Sure. And we had
ask. If I don't act on it, I forget.
Exactly. No, and we had proposed language. We had proposed language to more streamline the or clarify the bill back in-house healthcare, and I'm not sure that it moved forward. But the bottom line is,
Well, perhaps while we're talking about it, if you've got draft language, if you would please send that to Stephanie
sure,
or Chrissy, so we could take a look at it. Thank you.
sure. Sure, I will send it to both of them. And hold on, let me just make a note because I too forget if I don't write it down. The bottom line though is we are operating based on what we our intent of the stakeholder group that we had. So we are basically 60-40, and I can take you through details on that, but for the purposes of our budget, we're essentially 60-40. We were grateful for the 3% increase allowed by the administration, and then we are more than 3% because they gave us additional general fund for health insurance, retirement, and other pieces. So they gave us an allowance for that. If you look at our budget, you'll note that our health insurance is up a higher percent than some other things, and that's because we are blessed with a very young workforce. So we are doing our part to contribute to Vermont's population. We have a lot of babies and young kids. So we have we're a small operation, just 32 positions. So if we have people changing from single to 2% or 2-person to family, that has a material impact on our budget. Operating expenses, we held the line as much as we could, and the same thing with contracts as well. So, and if you look at our positions, we have our board positions. Our 5 exempt includes 3 attorneys, the executive director, essentially what's the private secretary or assistant role, and classified employees.
Okay. Any questions? Otherwise, we'll move to the next slide.
So on the next slide, the biggest change, which finance and management likes our ups and downs to tie to what they have. The biggest change though is we are incredibly grateful to have received the $500,000 for the benchmark analysis and low value care. So rather than changing up the ups and downs, I made the note there on the right in the yellow. And on the next slide, we can give you an update on the RFP and the timing for that work. In terms of the changes that we have in the ups and downs, the one thing that really there's 2 things that stand out. First, our salaries are a little bit higher than you might expect, as are our vacancy savings. And that's because we had an employee out on long-term leave. So we needed to do a double fill with a temporary position. So both look higher, the anticipated vacancy savings and also the temporary position. So that has subsequently been resolved, so we don't anticipate that in the future. But I just wanted to indicate that. The other thing is, you'll notice in rent, we were previously at City Center and had been paying the rent costs there versus paying for fee for space at 144, and the Cannabis Control Board has since utilize that office space at City Center. So now we're just paying fee for service where we're located.
Oh, at least you've got a funding source. Right now, they don't. Okay, so they moved into your space.
Yes,
Where are
Yes.
you now then, for those of us not conversant with the numbering of every building on Main Street or State
oh,
Street?
so we're 144 State Street. So as say you were gonna drive to the high school or to 89, there's two one-story buildings on the left before you turn on Bailey Road to go over the bridge. We're not the one on the corner, that's owned by the credit union. We're the one right before that. So,
Where the old credit union used to be on the corner?
we're not on the corner, we're right before the corner. There's two,
Next,
Somebody said it used to be a telephone company office at one time.
What?
Somebody told me that they used to pay their telephone bills there at one time.
Okay, I know, it's the one just before what used to be the old credit union right on the corner.
Yep.
Okay, well,
Yes.
now we're where to find you.
yes, well, absolutely.
All right, so
Absolutely.
you moved and saved money.
Mm-hmm. Yes. We did.
Well, that's nice. That's nice. And otherwise, it's pretty straightforward.
Yes,
In terms of most things are fee for space, salary and benefit changes,
yeah,
and then the benchmark, but that was a one-time, right?
yes,
The benchmarking was.
yeah, yeah.
We will have some sort of maintenance cost going forward
Okay,
once it's.
all right, so now you want to talk to us about benchmark analysis.
Yeah, and Stephanie, to your point, we haven't included anything for ongoing cost for the benchmark because it came up after we submitted our budget. But what we do have is we actually put the RFP out before the BAA was signed, kind of in anticipation of it going through because we wanted to turn the work around quickly. You can see the RFP. Well, you just have a paper copy, but I can send you the hyperlinks to the RFP, and bids are due next week on it. We're hoping to have the contract signed in August. You know, I realize that seems like a lot of time, but it's there will be data involved in the contract, so we need to both negotiate it and work with ADS on the data piece. And I talked to our data and analytics team, and they expect to see the kind of the results in iterations. So they expect that the first iteration of results will be available in, kind of late fall. So it depends on the quality of the bids that we have. We have received questions and responded to them, so it shows interest in the proposal. So that's a positive. And we're very grateful for the funding for that work as recommended by the consultant that you've engaged.
Yeah, I was going to say to the committee, actually I have, believe it or not, in my hand, the Health Reform Oversight Committee at the recommendation of folks at Millbank had Donna Kinzer do some consulting, and then she's done additional work for the other committees. And one of the things, well, I guess we saw a couple of the things, one of which is also in the bill that we just moved to third reading today, and that is how to take the reports and make them more accessible or usable and not quite as dense, that are issued by the board. And then the other was this benchmarking, and then of course the other is to really move toward a global budgeting, which was part of the bill that we dealt with on the floor today. So if anyone is interested, I just happen to have the December 10th report from Kinzer Consulting. So I'll let you keep going, but that's just some background information for the committee, because unless you're on the committee, a lot of things happen and you don't have really any context of what you're seeing here. So I'll let you keep going.
Sure, sure. So, the next page really speaks to our priorities. And these are intentionally not numbered because there's so many priorities and it's, but obviously healthcare workforce and access to care has been a huge priority. And Chair Mullen started talking about this really when I first came to the board in late 2017, probably before then, but that's to my memory. So he saw the writing on the wall earlier on that. Another priority, obviously, is hospital sustainability. Third is really in partnership with AHS and the Director of Healthcare Reform, negotiations with the Federal Innovation Center for the next healthcare reform agreement. That's separate from the 1115 Global Commitment Waiver, which you hear a lot about. This is a separate agreement. What's currently our all-payer model. Another is regulatory integration, which is really looking at, kind of the connection between the regulatory levers that the board has, hospital budgets and rate review, and, kind of how to integrate that. And then another priority is data integration, transparency, and quality. And we have an excellent data and analytics team. And one thing that's very important to know about that is we also have a data governance council. And we were early in the state on having that. So really being thoughtful about requests to use our data. And there are ADS participants, board members, and other participants on the Data Governance Council to be thoughtful about the data that we manage and how to use it best in order to inform decisions.
That kind of wraps it up. We'd be happy to answer any questions you have.
Really, questions?
Yeah.
Yes, Senator Starr.
Yeah, on the hospital sustainability, I'm sure you must look at their reserves and what is projected to be a healthy reserve for a normal, a regular hospital in Vermont. How many days or however you judge that?
So there is no one set answer, Senator Starr, because we have to factor in if a hospital has an older days of plant. So for example, where Senator Sears is, they're currently going through a capital improvement project. So they had one of the oldest age of plants in the state. And so that money was necessary to make sure that the hospital was kept up and could meet the current demands for healthcare in that region. So there's no one easy answer to that. There's a lot of factors that go into it, but certainly you would like to see days cash on hand at over 150 days.
Yeah, and well, in the news lately, the three, I think it's three of the largest hospitals have been looking for more money, and the smaller ones.
The mid-year increase that we've just received communication from Blue Cross Blue Shield. Don George has sent us a communication. So this is what this is why the question's being asked.
Yeah.
So the first hospital to come in and ask for a mid-year increase was Rutland. We've had that request and have been working on it for I guess about a month now. UVM just put in their request a little over a week ago, and that was for both Burlington and for Central Vermont. Not everything is accurate in the news article, Senator Starr. I know that at least one hospital that may not be the closest one to you, but isn't that far from you, is waiting to see what happens with the others before they come in, but they're actually considering it. And so what is happening is that for the first couple of years of the pandemic, large amounts of federal relief funds came into the system. And the way the relief funds operated, in some respects, there was some benefit to being small. So, for example, a couple of the hospitals were able to access PPP dollars from the federal government, and that helped them build up their days cash on hand. But if you had over 500 employees, which the majority of hospitals have, you couldn't access that. And so the relief funds were a life-saving event for the hospitals, but it didn't necessarily drill down to the perfect dollar amount for each hospital. And so you would expect a couple of the smaller ones wouldn't need to come in because they're still eating through those relief funds. But what you've seen from the ones that have come in is that they're chewing through their days cash on hand fairly quickly because of losses. And it's primarily inflationary factors. In fact, it is inflationary factors, the biggest one being workforce. So, for example, the hospitals that came in are in a similar situation where they gave their nurses 3-year contracts with 10% the first year, 3 and 3 in years 2 and 5 and 5 in years 2 and 3. And they hadn't anticipated the nursing crunch when we went through the budgets last summer. So practically every hospital was predicting that they were going to use fewer travelers this year. That started October 1st. The hospital fiscal year runs October 1 to September 30th. So the vast majority of hospitals anticipated using less travelers, and the exact opposite happened. Nobody anticipated that the Omicron variant was going to last as long as it did. The modeling that everybody was looking at back in the hearings in August was that the wave would end by the end of September, and we all know that didn't happen. So what hospitals are seeing is that because there was non-emergent care was ceased for a period of time, people weren't getting the normal screenings like colonoscopies and mammographies. And so now when a patient presents, it's a more acute patient that the hospitals are seeing. So that's why you're seeing pressures on ICUs and things like that. But the good news is for the last couple of weeks, those people in the ICU, there's very few that are related to COVID. And that's a very positive thing moving forward. So we have those requests in, and we're not allowed to speak on what our thoughts are on those because we would be prejudicial in the decision-making process. But you can understand that there were a lot of questions about why can't hospitals make it to the normal budget process in the summer by just using the reserves, because if this type of unprecedented situation isn't a time to dip in reserves, what is? So those are the things that we're dealing with, Senator Starr. And it doesn't matter what we decide for a decision, there's going to be a lot of unhappy people one way or the other.
Kevin, I'd like to ask, one of your priorities is healthcare workforce and access to care. Healthcare workforce, you did the nursing we have that nursing survey. You had Robin led that, I think, task force on.
The Rural Healthcare Task Force, yep.
As you know, certainly healthcare workforce has been a priority, particularly nursing. In critical occupations, we put quite a bit of money last year in the budget adjustment. We put more money. Can you just, if this is a priority, how do you see the board's role in addressing that workforce?
So we started having panel discussions about this when I first came into the position, and had a keen interest in the workforce and could see that we had an older workforce that was retiring, and it's not just nurses, it's doctors, it's techs, it's everything. And was concerned from the beginning. We helped put together a forum down in Castleton about 4.5 years ago that looked at what were the real bottlenecks to having enough nurses in the future, and testified in a few committees in the legislature, House Commerce, Senate Health and Welfare, and a few others about what I saw a few years ago prior to the pandemic as a crisis. And at the time, somebody said, you're being a little bit melodramatic, and I don't think I was. And the reality is that we're here because we didn't take the proper steps. And I'll tell you what I think are the proper steps. And I think there's some movement this year, and thank you to the legislature for that movement. But really what I see as the two main bottlenecks from growing our own, because I think we need to grow our own supply of nurses, is one, we don't have enough nursing faculty.
Well, we have a bill that is increasing money for the faculty, and then you've got to have the placement. You've got to have the clinical placements.
The precepting, exactly. And those were the two things that we were pointing out 3 years ago that just weren't being addressed. And we have Vermonters that want to go into nursing. So if you talk to people, 75% of the qualified applicants for these programs are turned down because they don't have the faculty or the clinical precepting experience in place. So if you fix those two bottlenecks,
I understand that, Kevin. My question is, how do you see the role of the board in, you're identifying it as a need? Is that how you see in providing the data that would support it, and the probably the cost implications that are attached to it if we're relying on a higher percentage of traveling nurses? I'm just trying to.
So the board's role.
Everybody is talking about the nursing shortage. On the other hand, we're also hearing lack of clinical workers in our mental health delivery system. It seems like nursing has taken all the attention, but then in fact your other critical workforce areas. And so I was just wondering how the board, as you identify it,
so what we do is
others.
Yeah, what we do is we work with the hospitals and push them to, and they do this on their own anyways, but we're always, asking questions and encouraging them to work on a pipeline approach so that so for example, where Senator Sears says, and his is the only hospital in the state that isn't using a traveler right now. And what they've done is they've embedded members from their nursing leadership team into the faculty at the college there. And that's a program that, Rutland is starting to imitate, and others. And so what we're trying to do is learn from what has been successes at different hospitals and sharing those successes with other hospitals to try to help them, and also to realize that in the budgeting process that there has to be this allocation for the workforce. And here's what I said to the House Commerce Committee, I believe 3 years ago, about at the time they were looking at a shortage in contractor workforce and manufacturing. And what I said at the time is, you have to accept the fact that a hospital can't be open when they choose to be open. It can't be like a restaurant that can reduce its hours. The hospital is open around the clock. So if they don't have enough staff, they have to hire the travelers. And the travelers were at 200% of the cost of an employed individual. Now they're as high as 300% of the cost of an employed individual. So we're paying for it in our healthcare premiums. You're paying for it in the Medicaid dollars. The federal government is paying for it in the Medicare dollars. And that's why it's imperative that if we want to get costs under control, we have to be willing to grow our own supply of providers in the state of Vermont. And it's not just nursing. So for example, there's a huge emphasis, and we have been talking about primary care, as has the legislature, for years now. And yet Vermont doesn't even have a physician's assistance program in the state of Vermont. So that's something that is in the workforce development plan that Director Backus and others work to put together. And it's something that needs to be looked into. I actually think it could help the sustainability of our state colleges if we had a PA program at one of the state colleges. And I do think that right now we don't have redundancy. We're relying on UVM to provide all our primary care providers, and that's not a very good place to be. So that's an area that I think needs to be addressed. But Senator Kitchell, you're absolutely right. It doesn't matter what the field you're in, there's a shortage and people can't find workers.
Yeah.
There's the great resignation that occurred during the pandemic, and
I know there's no workers, there's no housing, there's no cat food. I don't understand what's happened. But we've got to figure it out, and we've got to figure out the pipeline. I know that one structure we have is the AHEC structure that was put in place by HRSA, and for the whole purpose of pipeline, and they do administer the funding for a lot of the loan assistance, and they're interested in looking at how they can get better integrated with our state college system, or maybe even be co-located on a campus. So I think we all have got to think about what do we have for resources, how are we using them, and how do we maybe do things differently. But
and that's why I'm trying to highlight those two bottlenecks, because it doesn't matter how much you have for scholarship or loan forgiveness. If you have people that are willing to enter the field and yet you can't do it because they can't get into a program, despite the fact that they're qualified for that program, that's the problem. That's the bottleneck. And that's where we should be putting our resources.
And I think this committee would agree that we have to deal with the capacity issue, because we are not generating the volume of, in this case, nurses, but other professions as well related to healthcare. So,
can I give you a fact that you probably won't like, but can I give it to you anyways?
Well, no, we're only taking good news, Kevin.
So if you look at what New York State is doing, Governor Kathy Hochul has a $10 billion proposal for their healthcare workforce. And you say, well, New York is a huge state with a lot more people. If you take that 10 billion and you divide it out by the 22.4 million in the state, works out to $494 per capita in the state. If the state of Vermont were to do something similar, it would be a $315 million program. And yet, from what I've seen, it looks like we're allocating a little over $40 million towards healthcare workforce. I'm not being critical. I'm just, letting you know that it seems like a lot of money that you're putting out, but in comparison to our neighbors, it's not that much.
Well, we are small, that's for sure.
Yep.
One last question, and then we're going to move on to, because we're moving ahead.
Yeah.
We're going
Kevin, I was at a meeting last night and our executive director was saying that a couple of nurses left that agency, signed up as traveling nurses, and went to St. J, from Newport to St. J,
Yeah, that's
and
right.
went to work. So My question is, how do we start regulating our own people from just filling out a paper, quitting their job, filling out an application for a traveling nurse and go 40 miles and double their pay? There's something wrong with that
I
picture.
think.
There's absolutely
Welch-
something wrong with that, but
Welch was
it's
talking
going to,
about the very
yeah.
issue.
Yeah, Congressman Welch has tried to attack it from a gouging point of view, and I totally agree with that. One of the things that early on I had thought about, and Senator Baruth, you might have been on economic development when we passed the price gouging bill on gasoline. It might have been before your time there, but anyways, we in Vermont passed a price gouging bill on gasoline to prohibit that from happening. And I was thinking about what if the state did the same thing here, but then it was quickly pointed out to me by somebody smarter than me that those travelers would just go elsewhere and we would have a huge problem staffing our hospitals. So, but that was a thought that I had that really didn't make any sense.
Or nobody would enforce the law like they haven't never enforced the gasoline gouging law.
Well, it just shows when there's a shortage, what will happen.
It's up to the Attorney General and the gas couches. And that's the Attorney General.
Gas gouging on the nurses.
Won't call it hearing.
All right, well, I think that will kind of finish. Your budget's pretty straightforward. Appreciate your being here today. And if we have any questions, we'll get back to you. And I'm sure you're monitoring what we're doing in terms of legislation, so.
We are, and we're really, really grateful for your seeing the big picture on the sustainability of the healthcare system. And thank you for everything that you've done so far. Thank you.
Thank you.
See you guys.
Thank you.
Thank you.
Great seeing you all. Hopefully we can see each other in person at some point.
Well, we do have an in-person, our next witness is in person.
Oh,
I see Commissioner Gresham, so.
Yes, Commissioner Gresham is here in person. So we're going to move on to the executive office. I don't think about all the things you
I
guys.
just want to know though, can I walk 40 miles down the road and double my salary?
Why not?
I mean, I want to get in on that.
You were in Hershey.
There's why, I just, being nervous.
You're in the wrong job, apparently. For right now. Are we?
I was surprised to hear they went to Newport, the St. James.
Well, MVRH had a nurse that became a traveling nurse and went to Maine, and then they replaced it with a traveling nurse from Maine. That shows you how, yeah. But on the other hand, if you're a nurse and you've got the flexibility, why would you not do that?
Right. Well, in Sweden, they go over to Denmark and they make much more.
And you think about the number of nurses we're getting from the Philippines and medical professionals that we're getting from Pakistan and
Thank God they're
India.
coming.
I know, but you think about what it's doing to their own country.
Yeah.
They're losing these, these highly trained, highly educated individuals. On that note, we have Commissioner Gresham, who's here and is joined remotely by his staff.
Howdy, guys. You got my back.
Literally. So we're going to move right along, because if judiciary can come in a little early, that would be great, because Senator Sears has to, Dick, I don't envy you that trip back. A rocket run from Bennington each day is a killer. So we need to, if we can accelerate a little bit, then
Well,
we're in
this-
the judiciary and.
This doesn't have to take a lot of time, actually.
Oh, good.
This is pretty simple. So Adam Gresham, Commissioner of Finance, and thank you for listening to us. We're talking about the executive office budget, and I'm going to, you have sheet on your desk. I'm gonna flip to page 7.
Yeah.
Which,
Oh, we like these highlights and summaries.
Gives you a nice fat pie chart and a couple of bullet points. So the governor's office is 14 exempt positions, which includes the governor and many of the people that you know and love in his office. So that is this is the budget that includes that. And the pie chart shows you that the vast majority of his budget is general funded. However, a percentage, 10% of each salary is allocated out to IDT for the work that the governor's staff does for the various other departments. I'm afraid actually the chair may have, or actually around this table, you may have more history on how they got to that 10% amount, but it was there from as far back as I can remember. But so that's how they're funded. It's predominantly general fund, but there is an IDT amount is allocated out. The total budget general fund was up about 1.5%, a little higher in the IDT amount. So the total amount increase is 4.1%. Virtually all of which is.
So is the governor's a DC? He's all the exempts are DCs, right?
The exempts have the choice. I can't answer you whether he is a DC, but he has a choice. If I were a betting man, I'd say probably because
I think so,
the
because
vesting period.
generally when you're in an elected position, and the position as governor, it's not a lifetime, it's not 50 years in a gold watch position.
It's a 5-year vesting period, and most people, myself included, assume that you guys will can us before that. So
You hung on quite a while.
I'm coming up on 5 years.
Yeah.
Who would have thought?
Get that pink slip bill.
Unfortunately, once you make the decision, it is irrevocable, I believe.
So
Anyway, that's, really, I mean, as kind of,
so your increase is 43,000,
yeah. Okay.
or a total of that's general fund, total of 77.
Yeah.
Well, I suppose we should spend a lot of time on that committee.
Well, what I was gonna do is just the next page, the ups and downs, and offer you guys the opportunity to look at it and ask us questions. I was gonna yield to my colleague Hardy, who's gonna take you through that, but
This is another one I'd just like to claim credit for. Dr. D.
Or blame,
and
depending
the
on
ups
who you're
and
talking
downs sheet are my legacy from the executive branch.
so you created.
I think most of your constituents would understand Dr. Nuts. Don't think they'd understand ups and down sheets.
It is the best way of working through because you're having so much fun. And back in the days of social welfare, and huge budgets and huge divisions, so including Medicaid and so forth. And so it was a good way of a structured way, how you arrive at that bottom line.
But I'm kind of confused because,
Don't believe a word he says.
well, I don't know if these are relieve structural statewide pressures or makes things more affordable, because it's not written in over on the right-hand side.
Well, that was gonna be our committee exercise.
You
Oh,
can
we
fill it
better
in. Yeah,
just-
you have 3 choices, I believe, buckets,
Yeah.
and then put everything in.
They're all white, they didn't bother to tell us.
Oh, I don't know, that's interesting.
In finance and management, we don't typically correct the governor's office when they hand in their work. But would you like me to offer some highlights real quick, Adam, on the ups and downs?
Please do.
Okay, sure. So with a department such as this, over 75% of the expenses related to salary and benefits, they're primarily staffing. So with salary and benefit pressure to come in at that net 4% increase required, finding other areas to make offsetting cuts. The operating expenditures decrease of $24,000 is driven in the largest part by cutting travel expenses by about $16,000 there's some reduction in IT expenses as well, and a couple thousand worth of sort of general unspecified.
How are you going to travel, Cardi? Obviously the governor's office, the governor does a lot of travel, just inherent in his job. So this is the staff in the office that would be primarily affected by less travel, or they'll have to ride carpool with the governor.
I'm not sure if our FSD CFO, Holly Anderson, has further detail, but what I can say is they'll continue to do their jobs the way they have been for the past couple years at any rate, and the costs should be fairly similar. Do you have any other details to add,
Which is
Holly?
basically office bound because everything's been remote, so there's been very little travel. Yeah.
Right, that is correct. Most of it is in-state travel. There is some out-of-state travel that was in the FY22 budget that we reduced to get to the 4.1 increase. So it does include both in and out-of-state, mostly in-state travel, and it affects the entire office. So it affects all staff.
Thank you very, very much, Holly.
So I have a question, in-state travel and transporting the guy is driven by obviously someone from public safety, state trooper. Is that all in the public safety budget, those costs of the vehicle and the cost? And also I would assume the salaries would all be in the, I guess I've never thought of it before, but I was just wondering, are those costs anyway allocated to the governor's office, or are they just embedded in public safety?
That actually is part of the MOAs between Department of Public Safety. So some of those costs are in the MOA agreements, and you'll see the interdepartmental transfer fund. It's payments that refer or come from ANR, DPS, AOT, and I believe it's on page 22 of your handout that lists out all the departments. So there's a $22,000.
We only got page 10.
We just have a copy.
Yeah.
You only go to page 9.
It's that whole vision report.
But you would have it online, Alice.
Yes.
No, I don't need to see it.
It's ANR, GPS, and then AOT and Human Services, AHS. So there are 4 of them. But to the chair's question, that would be the way it's handled.
What
Yes, go ahead, sir.
one thing I think the legislature lacks is constituent services. So can you describe that? Because a lot of times for constituent services, I contact the commissioner or whatever department it comes under. So I'm just curious, is your constituent services, what do they do?
Sometimes they refer the people to me.
That's right.
Yeah. Well,
So I'm curious, I mean, I've spent a lot of time with, like Kendall Smith is excellent to work with, but I'm curious as to constituent services since do they refer people to the commissioner or is this the peer person answering the call?
So when you call 828-3333, the woman, typically Mary Ann Davidson, who's one of the 14 that you see on this sheet, will answer the phone if she's in, and she works 5 days. She answers the phone and then she makes the decision as to where to direct it. Very often, in fact, more often than you might imagine, she can answer the question herself. I mean, many of these people are just calling to make a comment. Oh, why are they doing this? Or, hey, I saw someone out there like that. A lot of people who call are responding to advocacy emails saying, call the governors. So, but the first constituent service touch point is typically Mary Ann Davidson. And she will farm it out to the appropriate commissioner, public relations officer, or the like. So that's how they do it.
From the Appropriations Committee have a constituent service?
I want one.
Yeah, look into the.
Yeah, look in the mirror.
Yeah. That's as far as it gets.
Yeah. Other comments or questions, of the commissioner?
Pretty straight.
So,
It is pretty straightforward.
Marty, did you want to finish up?
Sure. To wrap it up, the most significant expense decrease is the elimination of temporary employees from the budget. So that's the $52,000 down. So those are the two significant expense decreases. And the only other thing that I wanted to note for the committee, and actually the one somewhat unusual aspect of this budget submission, is that you'll notice that the interdepartmental transfer column on the ups and downs is up about 17%, whereas the general fund column is up only 1.5%. The net increase, all funds, is the 4.1%. So the reason for the IDT increase being greater on a percentage basis than the general fund increase is that there was actually a change in this budget of the percentage allocation of staff between general fund and IDT. So Adam mentioned that split, and actually in recent history, it was actually a 92% general fund and 8% IDT split, and this budget represents a 90-10 and a shift in that amount. And the affected agencies with the cost share remain the same: ANR, DPS, AOT, and AHS. But I just wanted to point that out for transparency, because that is the one aspect that really is a change in this that doesn't perhaps jump right off the page, but it does if you look at the numbers. So that's about all I had to point out for the committee.
Thank you. Other questions or comments? Nice, you could come over, Commissioner, in person.
Nice to be over too. My goal was to find you guys some extra time for your serious deliberation.
Yeah,
Well,
yeah.
well, the governor was in Danville yesterday.
I saw that.
Was in Bethel yesterday too.
Yeah.
It was all over the place.
What's that?
Love
Kitty
travel.
posted pictures
That's his
of
travel
you and the
expenses.
Oh,
Right,
really?
using an electric motorcycle.
We're giving out the Borac money, and the House only put in 3 million, and your budget had 5. and-
Well, that is one thing that we frankly would say they
So
should.
he made a point of, I told him it was on my list for consideration.
That is incredibly leveragable, that money.
Huh?
That's just because we give the money out and it's all volunteers that build all these things, put them in place. I mean, it's just a terrific way to leverage.
I mean, but there's some great stuff happening.
Actually, some people from Pownell came, Dick.
They
What a
did.
lo- Pownell to Danville is a long trip.
Yes, it is.
Yeah, they had to come up, they came over Route 11 and then up the
Yeah.
interstate. But it's still a hike to get up to the kingdom. And there were people from Bethel, but Pownell obviously was the
Well,
longest
it's a
distance.
headline in the local paper this morning, and I haven't had a chance to read the story, but they got, Tom got one of those. grants.
Yeah, they did.
And town of Ludlow too.
And Hardwick and Groton and,
So I'm gonna look at the front page again just to see what grants.
It's in the announcement.
See what Brian's doing.
Huh?
See what Brian's doing.
other
Yeah, Brian
questions
got
of the,
credit for it, I'm sure.
of the commissioner?
Right, Brian wasn't.
Thank you, guys.
All right.
This has been a pleasure.
Yeah, doesn't that seem good?
That's nice to have somebody in the chair, literally.
I think I'm the first one in that chair.
So
Is that
judiciary can't come
They're in
in.
House Bill Ops until 2:30, but they'll be here promptly at 2:30. So I was chatting with Stephanie about an option for,
What time is it?
is it just after
Just a little
2?
after 2 or a little after 2.
Thank
You have a discussion if you wanted to, and just,
All right, well, Adam, do you have any other comments other than the Borac?
Tom's one of 379.
Well, we actually have a lot of comments. I'm not sure you have that time.
All right. So are you prepared to fill in the blanks?
I was not prepared, but we could,
Or we can just go offline and come back at 2:30 for the scheduled testimony.
Is that all right?
Why don't we do
Okay,
that?
2:30 we'll reconvene.
All right.